We had a protocol with crenolanib in patients with acute myelogenous leukemia, relapsed refractory who had failed at least one prior therapy after newly diagnosed induction treatments, which typically is an anthracycline cytarabine combination. And these are patients, these are all comers. They're not necessarily FLT3 positive. They could also have other mutations based on the NGS data set or cytogenetics. And the idea and the goal of the study was to see how crenolanib combines itself very well with a salvage regimen, such as the HAM, which is high-dose cytarabine with mitoxantrone, or FLAG-IDA, which is fludarabine with high-dose cytarabine along with GCSF and idarubicin. And so we looked at about 20 patients. It's early data, and the idea for this is to get safety information. This is a very similar study design that is going to happen in Germany. It's a phase 3 randomized study with either HAM or FLAG-IDA with or without crenolanib with a placebo. So this is sort of the safety cohort, if you will. We had the largest number of patients. The other centers included UT Southwestern in Dallas. We had Dana-Farber. We had City of Hope and Roswell Park in Buffalo. And what we saw was crenolanib, which is a pan-FLT3 inhibitor, which is given at the dose of 100 milligrams 3 times a day. It allows itself to be combined very well with some of these salvage regimens without any additional toxicity. That's number one. Number two is the design of the study was that they get the salvage treatment for the first 5 days or 7 days, and then they start the crenolanib on day 8 or day 9 until day 28 or count recovery, and of course, and then evaluate the response. We had a couple of patients who had the TKD mutation, not the FLT3 ITD, and those patients all achieved a complete remission. So to just remind you, these are patients who are primary refractory, which means they failed one treatment, couldn't achieve a response. So these two patients achieved a CR with this combination regimen, which I thought was impressive because there are not many FLT3 inhibitors out there that can actually inhibit the TKD domain. Then we also had a couple of non-FLT3 mutation patients who were primary refractory who achieved a CR with this regimen. So the data is early, but it's a good safety data, and hopefully this is what we will carry on with the phase 3 study that is going to happen in Germany.